My name is Mpimbaza. I am a senior lecturer at the Child Health and Development Center. And I joined this center in 2011. That makes around 13 years of working at the center. My area of interest is in malaria as a disease. Malaria is a disease that accounts for a large proportion of childhood deaths in this country, a situation that has been present for the past 50 years or more since independence. Malaria has had that position, unfortunately. At the center, I manage or head a program referred to as the Systems for Health and Malaria Research Program. It's an area I head for reasons that my career over the past 20 years has focused on malaria. And more recently, I've come to the understanding, and this is based on my own personal experience and based on what we know about malaria, that if we are to achieve malaria control in this country, we need a holistic approach to addressing the problem. And that holistic approach entails strengthening the entire health system, not piecemeal vertical interventions that target one item and leave out the other. I think that has been tried for a long time, and that effort has not realized as much as we should have, given the amount of money and effort that's been put into malaria control over the past 20 years. So the focus, as we speak now, and this is a focus that has also been adopted by the Ministry of Health, Uganda, acknowledging that we need a horizontal approach in implementing interventions, targeting all the components required to control malaria. I'll just talk about one of the flagship programs that falls under the Health Systems for Malaria Research Program. And this program is actually sponsored by the Makerere University Research Innovation Fund. Over the past 5 years, we've been, not 5, maybe 3 years, we are focusing on developing a model health systems strategy to reduce malaria mortality in this country. And we are developing this model using the Busoga sub-region as a case study. Over the past 3 years, we have been working on developing a model health systems strengthening project, right? With a goal of developing a model health systems strengthening model that will be used to reduce malaria mortality. Our model is premised on 2 principles. The first principle is innovation, and the second principle beyond innovation is that it's premised on the thinking that if you have a problem at home, the people best qualified to solve that problem are the people who live in that home. Home-based solutions for home-based problems. This model aims at bridging the gap between the service provider and the community. The communities are the people who fall sick of malaria, and the providers are the people who provide care and help communities prevent malaria. Over the years, we've come to the conclusion that there's a gap between the provider and the community. So our interventions are aimed at bridging that gap between the provider and the community, such that when the provider is offering a service it is to the satisfaction of the community who the provider is supposed to be offering the service. Likewise, the community interventions are to ensure that the community accepts the services that are being offered by the provider. Above all, that the community takes up preventive strategies for malaria control, such as use of bed nets, such as behaviors that promote appropriate care seeking when they fall sick. We know that when people fall sick and they delay to come to the provider, it allows the disease to progress from being mild to severe. So we would like the community to start responding faster and appropriately. When they fall sick, the first thing they do is they seek care at a provider. In turn, the provider must be attractive so that he can attract that person to come to the facility for care. Above all, that malaria mortality can become a matter of history in this country. It's achievable. We have all that it takes, or we know all that it takes to prevent malaria. We know what it takes to treat malaria. I think what's lacking is the coordination of having a system that addresses all the components and puts them in one box, ensuring that the provider is offering quality care and that the community is satisfied with that care, and above all, the community takes up measures to prevent occurrence of malaria, and if they get malaria, they seek care in time. That's our flagship program, and we have branded it Bunifu at Health System Strengthening. Bunifu is a Swahili word that stands for creativity and innovation.